So I've always had a hard time swallowing. Growing up, even as a child, had a hard time swallowing pills and so forth. As a teenager, I found out my dad had what's called Barrett syndrome. Back then, the treatments that were available were not the most, I guess, exciting would be a nice way to say it. And so that always worried me that I might have that growing up, and it always made me a little bit nervous about seeking help because I saw what my dad had to go through, and really I wasn't looking forward to that. Over the past year or so, I'd gotten to the point where I could hardly swallow anything. And when I was eating, I was only eating part of a meal and taking me longer than most people to finish the entire meal. So at some point, I finally decided that I need to go and get some help. So when I first met Dr. Abiodun, his bedside manner is great. He just makes you feel at ease and like everything's gonna be okay, he's gonna take care of you. And so there's just an immediate trust that you feel with him, which is great to have when you're dealing with something like this.
In David's situation, he has several years of acid reflux since teenager. He is now having difficulty with swallowing. While that is typical, it is suggestive of complication of this disease, which informs the decision to proceed with endoscopic evaluation even before considering medication treatment.
So during the procedure, they insert basically a cable that has a camera in it, and they can look around and see if there's any cancerous or precancerous things going on, see if there is scar tissue from the acid reflux. They can also take biopsies through that same tool and send that off to the lab to test and confirm whether there are any precancerous or cancerous situations that need to be addressed. Once they take a look, there's also a balloon that can be used to dilate the esophagus and basically stretches that out, and that's what allows me now to be able to swallow. In my case, it was so bad that I had to come back for a second treatment. Yeah, the only problem is now I've got a weight issue, so I can eat a lot more than I did, so now I have to watch out for that.